You look at this case, you notice that the right kidney's intensity is different than the left. There's dilatation of the pelvis. You look at it in the coronal view, very nicely seen. And now you're trying to figure out what's going on here. Could this be just infection? Is it something related to the renal arteries? But with the dilated pelvis, you know you're dealing with obstruction. So now, what's the reason for obstruction? You start following things down. You kind of see a stone there, and you follow it down. You see the stone right here. So pretty good visualization of that. And here it is again when you do the reconstructions. So sometimes I do like looking at the coronals. I think one of the things that also helps, the urologists often want to know precisely where the stone is, L4, L5, S1. It's easier to define very specifically, and also often the urologist will follow the patients, and you would like them not to follow with a CT, so they'll follow with plain film, so you really create a plain film equivalent to look for any changes. And at times when I'm uncertain if something really is in the ureter or it's maybe just a calcified node, sagittal views work very nicely. Here you see the ureter, you follow the ureter downward, and here's the stone. When I speak about renal masses, I also